Hello dear students, I am Dr. Muhammad Assam, lecturer of neurology, Faculty of Medicine, in Shams University. In this video, I'm going to show you how to examine the muscle power. At first, you should greet your patient, introduce yourself to him, explain the procedure and take his permission. ازيك؟
ازي حضرتك؟
اخبارك ايه؟
الحمد لله.
انا الدكتور محمد عصام مدرس الاعصاب.
اهلا بحضرتك.
استاذنك افحص حضرتك.
اتفضل.
تمام. When examining the muscle power, we'll start with the small muscles of the hand. So we'll start with the opposition movement, the finger opposition. I will ask the patient to make a firm opposition of his thumb against his little finger, and I will make a resistance. زق على ايدي جامد، تخلينيش اعدي صباعي. Okay. Then I will examine the finger adduction. So I can put a piece of paper in between the patient fingers and I will ask him to press on it firmly. اقفل على الورقة جامد يا محمد، جامد. And I will make a resistance to try to take the paper out of his hand. Then I will examine the wrist flexion and the wrist extension. The wrist flexion, I will ask the patient to make a wrist flexion and I will resist him. زق على ايدي جامد. I'm asking the patient at every single time to make a resistance to me. Then the wrist extension, زق على ايدي لتحت. Then the ulnar flexion, I will let the patient to make an ulnar deviation, then to make a flexion movement, زق لفوق. كويس. Then the radial flexion, I will ask the patient to make a radial movement, then to make flexion and I will resist him. زق على ايدي لفوق. فوق. لا كده في الاتجاه ده. تمام. Okay. Then I will examine the elbow flexors. I will ask the patient to make flexion of his elbow. شد اتني دراعك جامد. I asked him to bend his arm. Then to extend his arm. افرد لبره. افرد جامد. Okay. Then when examining the shoulder, I will do the shoulder abduction. So I'm asking the patient to make abduction. افرد خد دراعك كتفك لفوق. Okay, and I'm resisting him. Then the finger adduction. خد دراعك ضم دراعك عليك لجوه. Then the shoulder flexion. Okay, خد دراعك لقدام كتفك لقدام. And I'm resisting him. Then the shoulder extension. زق لتحت. زق لتحت. Okay. Thank you. When examining the muscle power in the lower limb, we'll start with the big toe. So you should examine the dorsiflexion of the big toe. خد صباعك الكبير لفوق يا محمد. صباعك الكبير لفوق جامد. Okay. And then the plantar flexion. زق لتحت. Okay. Then the other toes. خد صوابعك لفوق. I asked him to bend his toes upwards. And then زق لتحت يا محمد to bend them downwards. Then I will examine the ankle dorsiflexion and plantar flexion. When examining the dorsiflexion, I'm asking the patient to bend his ankle upwards. And then the plantar flexion. زق لتحت. Okay. And then the ankle inversion. خد لجوه. Okay. And then the ankle eversion. خد لبره. Okay. At every single time, I shouldn't forget to examine and compare to the other side. So I should do all these movements on the other side to compare both sides. Then around the knee, I will examine the knee flexion. اتني ركبتك. I'm asking the patient to bend his knee. افرد ركبتك. The knee extensors. Then around the hip, I will examine the hip flexors. خد رجلك على بطنك. Okay. And then the hip extension. زق لتحت. زق لتحت. I asked the patient to resist me. Then the shoulder abduction. I will ask the patient to make a lateral movement of his hip. زق لبره جامد. And I am doing a resistance. And then the shoulder adduction. I'm asking him to make his leg inwards. خد رجلك لجوه. Okay. So to conclude your findings as regarding the muscle power, you should comment if there is any weakness and the distribution of this weakness, of this distal or proximal or distal more than proximal, and flexors, comparing flexors to extensors, abductors to adductors, to finally get an account of this weakness is due to a lower motor neuron lesion or an upper motor neuron lesion. Thank you.